Hello, friends. Good morning, good afternoon, and good evening, depending on wherever you're watching me from. All right, so today we are going to be looking at another interesting topic. We are going to be looking at the impact of estrogen levels, not just estrogen, declining estrogen levels in women that are experiencing early perimenopause. I've been talking about perimenopause. It's a very wide topic. It's a broad topic. So that's why I've been talking about it. And the symptoms that you experience can be hot flushes, mood swing, sleep disorder, dryness under there, um, low libido. You might not want to have interest with your partner in meeting with your partner again. You also experience mood swings, irregular periods. There are some cases we have osteoporosis, a lot of things, joint pains is much. So if you have been following me, you will see the video there in my page. You can check it off, the symptoms of perimenopause. All right. Now, if this is your first time of joining me, please just say hello. Let me know where you're watching from, and then drop your comments. You can ask your questions. And if you want to chat me up privately, you can WhatsApp me on 08034 005928. All right. Okay. So today, what is the impact? That is what we are going to be looking at. Oh, thank you very much for watching me. Akini Bioluwa Toyin, thank you so much. Thank you. All right, so what is the impact of declining estrogen levels in women experiencing early menopause? That is what we want to look at today. Now, estrogen levels plays a very important role in every woman's life. And that is when you notice that when there is a decline, you start having issues like hormonal imbalance, you start having joint pains, you start having symptoms related to perimenopause. Oh, Madam Joy Okafor, thank you so much for joining me today. Thank you. Please share this video, and then please click on the follow button if you're yet to follow me, so that you can always get notifications like this when I'm live or when I drop a video. Now, let's look at the introduction part of it first. Perimenopause, like I always say, is a natural transition. All right, that is a natural transition leading to menopause, and every woman must experience this. Now, some women don't even know that that is what they are experiencing. Some of them don't understand the changes that is taking place in their body because they are not aware. And that's why I keep saying share my videos, because it will create awareness. It will help to create awareness so that you will not see it like, oh, it's an attack, oh, it's something. Oh, you're watching from Ogun State. Thank you so much. Borderline between area between Idiroku. Oh, this is your first time. Thank you so much. Please don't forget to click on the follow button so that you can always get notification when I'm live like this, all right? And share the video link so that other women can join us. This is just an awareness call. We are creating awareness in women, all right? A lot of women are passing through this, and some of them, they see it as maybe an attack. Some don't understand what is happening, all right? But these are things that women must always pass through. Perimenopause, like I said earlier, is that transition phase leading to menopause, all right? Is that years where you start experiencing symptoms leading to menopause. And after 12 consecutive months, you did not see your period, that means you have entered menopause. All right, but if you have seen it up to, like, you have not seen it for like 6 months or 7 months, 8 months, and then it now comes, then the circle will now restart itself again. Now, perimenopause, like I said, is that years leading to menopause, all right? And then early perimenopause is also characterized by declining estrogen levels. And that is what we are going to be looking at today, the impact of declining estrogen levels in women experiencing early perimenopause. Okay, now what can cause this? What are the symptoms when you start experiencing this? What are the changes that you will notice in your body? And then another thing again is that you need to understand the impact of these declining estrogen levels, all right? Because it's very crucial for you to manage the symptoms and your maintain your overall health. All right. Now, what is estrogen first if we want to start? What is estrogen? Now, estrogen is that hormone, okay, that plays a crucial role in regulating body functions, all right? It regulates bodily functions, all right, such as your menstrual cycle. Estrogen levels, when it's normal, your hormones are normal, is that hormone that plays a very important role in our body, and it helps to also regulate and also maintain some various bodily functions, such as your menstrual cycle, such as your bone density, such as your vaginal health, such as your libido, your mood. Now, when there is a decline, thank you so much for the lights. When there is a decline in these estrogen levels, that is when you start noticing irregular period, you start noticing joint pain, body pains. um Madam Ifoma Okoro, thank you so much for joining. You start noticing body pains, joint pains. You start noticing all these things. And you notice that you don't have libido. That urge to want to meet with your partner is not there again because there is a decline in the estrogen levels. Every woman must pass through this. Every woman pass through it. But how you manage your situation, how you maintain your overall well-being is also very important, and it will help you to go through this phase without stress. All right. Now, estrogen levels also, declining estrogen levels can lead to a lot of symptoms. All right. And some of these symptoms of declining estrogen levels is one, hot flashes. You notice these hot flashes and night sweats. There are some people, oh, we have Omo Omolade Dada. Please forgive me if I'm not pronouncing your name very well. You're welcome. Thank you for joining. Please share the link. Share the link. Okay, you're watching from Aba. Oh, Madam Ifoma, thank you so much. And this is your first time. Thank you so much. You're welcome. Thank you for joining me. Thank you. Now, what are those symptoms of declining estrogen levels? Please share the link. Share the link so that other women can join us, because this is a phase that every woman must pass through. It is a phase that you must pass through. But you need to manage the symptoms. If you can manage these symptoms, then you enjoy yourself. All right. Now, hot flushes. One of the symptoms is hot flushes and night sweat. So many women experience this a lot, and they can't sleep well at night. They find themselves, okay, Chooks Agbo, thank you for joining. They can't sleep well. You notice that they're always changing their clothing. In fact, when they go out and come in, they just want to be under the shower. It happens to women a lot. Then this vaginal dryness and decreased libido. You notice that your vaginal area is always dry. You don't have, it's not wet. You don't have that urge to want to meet with your partner is also another symptom. Mood swing and anxiety, depression. It can throw you into mood swing for no reason. You can get angry, you can flare up, you will just be sad for no reason. You just want to keep to yourself. You don't want to talk to anybody. Those are mood swings. It can throw you into that kind of mood swing. All right. Then weight gain and bloating. You notice that you're experiencing weight gain mostly around your belly region. You are doing all you can, but you just notice that you're just adding. You're noticing weight gain, you're noticing bloating, even when you did not eat. Thank you, Emily Okoro, for joining us. If Okaro, even when you did not eat, you notice that your stomach is very full. You notice that bloating is a symptom of declining estrogen levels. Now, for women experiencing this, you can use this Vitalize for Women. It's super good. I use this and it's very effective. All right. This is Vitalize for Women. Now, this Vitalize for Women helps to boost that declining estrogen levels. It also takes care of those symptoms associated with this perimenopause, all right, and even menopause. Symptoms that I just mentioned: hot flushes, mood swing, sweating, bloating, declining estrogen levels. It takes care of this and many more. We have about 70 symptoms of this, but I've not listed all. I'll just mention a few. All right. And if you want to know how to get this, you can just WhatsApp me on 08034005928. My number is there on the screen. All right. So you can chat me up. Then another symptom is fatigue and then low energy. You notice that you're always tired. You have not done anything. Just 5 minutes walk, maybe from here to your bus stop or from here to the next street or something. You're tired. You don't have that energy again. This will help you. All right, you don't have that energy, it will help you. And then decrease bone density and increase risk of osteoporosis. Now when there is a decreased bone density, there is every risk that you might have a fracture or osteoporosis. And this is not good. Now this contains calcium, it contains magnesium, it contains vitamin D, it contains iron, it contains vitamin C and all the B vitamins, all right? So it's also good for your bone density. Now let's look at the physical changes that can happen if you're having a declining estrogen levels. One of it is that you notice that one leg is getting thinner than the other. That is osteoporosis. When you're having a declining estrogen levels, that means it's also affecting your muscles and your bone density. So one leg is getting thinner than the other, and you notice that even your vaginal tissues, they are thinning and they are getting dried also. You notice that is thinning and drying of your vaginal tissues. You will notice that as a lady. And then there's decreased vaginal lubrication. You notice that area is always dry. All right, and that is when some women complain of painful intercourse, and they will not be excited to want to meet with their partner for, you know if they want to join. Oh, wants to join the video. Okay, thank you for joining me. Please share the video, and if you're yet to follow me, please click on the follow button. We're on YouTube, Facebook, TikTok, and Instagram. Healthy Aging with Annie. All right. Then another thing again that you will notice, the physical changes when there is a decline in estrogen levels, is that your breast tissues and density. You notice that breast tenderness. Many women notice it. Breast tenderness, you notice it. So take note of the body changes you're experiencing. And then you notice that your hair again is getting thinner and thinner. All right, you've been losing hair as well. There is a declining, that is one of the impacts when there is a declining estrogen levels. All right, and then you notice changes in your skin texture and elasticity. So take note of these physical changes, check yourself and take note of it. You can chat me up if you want to talk to me privately, and if you have any question, you can drop it there on the comment section. All right, my number again, WhatsApp number is +234 8034005928. Now, what are the emotional changes when there is a declining estrogen levels in women experiencing early perimenopause? Now, early perimenopause can start between 40 years. When you are up to 40 years, some from even 39 years and above, they start noticing these symptoms. All right. Now, emotional changes can be mood swing and irritability. Little things can irritate you. That's one of the emotional symptoms. Little things can irritate you, and then mood swing. And then there's anxiety and depression. And then there is decreased self-esteem and confidence. You're no longer confident of yourself. You feel any little thing, your mood has changed. It can affect you. Those are the emotional changes when you're experiencing declining estrogen levels. And then there's changes in libido and sexual function. I've mentioned that before. All right. Then another changes that you notice is your cognitive changes. All right. Memory loss. So women start experiencing memory loss. They have difficulties remembering things. All right. They find it difficult to concentrate when they start experiencing these declining estrogen levels. If you want to know how to get this to help you get back that confidence, that vitality, just WhatsApp me, like I said, on the number you're seeing on the screen. All right, and I'll tell you how to get it. Okay, so some women also experience decreased focus and attention. They find it difficult to focus on something that they are doing, aside the memory loss, and they find it difficult to pay attention to details also. This is as a result of that declining estrogen levels. Now, for that, I will advise women to go for this also. Okay, this is Arctic Sea. It contains omega-3 fatty acid. Is good for your cognitive function. Is good even for children, for their brain, and even as an adult, because as you age, some of these symptoms will come. Now, not every woman will experience the same symptoms. Everybody experience their symptoms separately. So what I will experience will be different from what you will experience, okay? So take note of your body changes, take note of it, note it down, and when you go to meet with your doctor, you can discuss with them. If you want to discuss with me, that's my number on the screen, 08034005928. All right, so you experience this, and there are some, they can even there can be risk of increased dementia. All right, increased risk of dementia can be possible in some cases, okay? And then you notice changes in the sleep patterns. You might not be able to get that quality sleep because of these declining estrogen levels, okay? So take note of these details, please. Now, what are the risk factors? One of the risk factors of this is that family history of osteoporosis or breast cancer. Now, if in your family there's this history of breast cancer or osteoporosis, you need to check yourself, monitor yourself so that you can avoid all of this. Then early menopause can also increase is also one of the risk factors of declining estrogen levels. And then smoking and excessive alcohol consumption. You need to avoid this because it's also one of the risk factors. Then lack of exercise and physical activities. A lot of people don't do exercises, and it's very important that at this stage you need to move. Okay, my WhatsApp number again. All right, 08034005928. I'll put it on the comment section. My WhatsApp number again, Madam Ifoma, is 08034005928. I hope you got it. 080-3400-5928. That's my WhatsApp number. All right. If you're watching outside Nigeria, just put +234 before then 80-3400-5928. That's my WhatsApp number. All right, thank you. So if you have this family history, please check yourself. It's very important. All right. And then smoking, like I said, the lack of exercise, you need to try and do physical activity, is very, very important. And then poor diet and nutrition. You need to help yourself and start eating a balanced diet, more fruits, more vegetables, reduce your intake of foods that junk food, reduce it, and foods that can trigger symptoms of joint pains. You need to avoid it, like caffeine, spicy food, most of these junks, too much of white bread. You don't need all that at this point in time. That's why I said if you can do a lifestyle changes, you go through this phase seamlessly. And with the help of supplement is very good because your body needs those vitamins that you cannot really retain. So supplementation will help your body to get these vitamins and give you that vitality back. All right. Okay, who is this? Okay, Madam Modupeola, thank you so much for joining. Please share the video, share the video. And if you have any question, please drop it on the comment section. Thank you. So poor diet and nutrition is one of the risk factors as well. All right. Now, how can you manage these declining estrogen levels? There's so many ways that you can manage it. Practice lifestyle changes, make sure you're having a balanced diet, you're doing physical activity, all right? And then your bone density test, try and go for it, and then to help you prevent osteoporosis, all right? And then you can also add this as part of your lifestyle changes, okay? It will help you to boost that. This is the one I'm using. This is it. So it will help you get back that. So what I do is I take two. I've not taken um that of morning. I take it twice a day, morning and evening, or you can take it afternoon and evening, because I know I'm going to come live. So that's why I had to wait. Let me just take it. So it will help you, give you back that vitality and take care of most of these symptoms that I've mentioned, okay, and even more. You will notice your skin. You will notice that glowing in your skin. you notice a lot of things. That estrogen levels that is declining, you notice that it will no longer be there. Even your sleep disorder problems, it will help you to manage it. Okay, even that dryness in your, when you want to meet with your partner, it will also take care of it. So it's very, very good to give you back that your confidence as a lady. And aside that, that vitality, that tiredness will not be there. Many people feel tired when they walk short distances, even within their living room, they get tired easily. So it will help you take care of all that, and it will help to prevent that muscle loss of muscle mass. All right, it will help you to prevent it because it contains calcium, magnesium, and vitamin D. And with the help of calcium and magnesium, it helps divide your with the help of calcium, magnesium, and vitamin D, it helps your body to absorb the calcium and do its work very well. So if you're taking a calcium supplement and you're not taking it with vitamin D, your body will not be able to absorb it very well. That is why if you look at labels, always read labels. You will notice that most calcium supplement, there is vitamin D and magnesium there, or just vitamin D. So take note of it. All right. So in conclusion, what I'll just say is that declining estrogen levels during perimenopause can lead to a significant impact on every woman's physical, emotional, and cognitive health. All right. So you need to understand these symptoms, and you need to do what is expected of you to do so that you can manage these symptoms seamlessly. In fact, once you start practicing lifestyle changes, you will notice that most of these symptoms are not there, and you go about your duty normally. Even that sweating, that hot flushes, you will notice that it will go off because you're following the rules and regulations of this perimenopause. You're following the rules and regulation. Every organization has its own rules and regulation. So as a lady during this transition phase, you need to go by the rules and regulations so that you can enjoy yourself, so that you can get back that confidence. There are cases where I've got calls from people where they call me even at the age of, I there was one call I got. The lady said she's 33 years old. She started experiencing these symptoms. That is what we call premature perimenopause. We have premature perimenopause, which is from that age 30 to 30, 38, 39. Then from 39 to that your late 40s or early 40s, we call it early perimenopause. The normal time that menopause is supposed to start, thank you for the thumbs up, thank you for the likes, is meant to start at least from age 50, 51 and above. So if you start experiencing the symptoms early, we call it early perimenopause. But you can help yourself and manage the situation. You can help yourself to turn things around. You can help yourself to live your life normal. That is by following the rules and regulation, doing those things that it wants, avoiding those junk foods that triggers the symptoms. Live on fruits, vegetables, and natural foods. They will help you. We have fish, we have fruits, we have vegetables, we have swallow. You can do plantain swallow, you can do oat swallow, you can do even your amala. It's not as if you can't eat it, but you reduce your intake of, limit or reduce your intake of carbohydrates, and do more of fiber foods and protein food, vegetables and fruits. So you can play with these things. At least we have carrot swallow. People do it. Yes, you can do it. So if you're juicing your carrot, that's what comes out. Don't throw it away. You can use it as swallow. Just get a binder, Ceylon husk, or you use oats to bind it, and your swallow will be strong and good for you to use. So once again, this is Healthy Aging with Annie. Thank you so much. Our time is already fast spent. I don't like staying long so that people can get to watch the replay. All right. So if you're yet to follow us, please click on the follow button. YouTube, Facebook, Instagram, and TikTok. Healthy Aging with Annie. And you always get my videos, and I always come live on Tuesdays, Fridays, and Saturdays. Though sometimes I still come live on Wednesdays. All right. So please don't forget to share this video. And if you want to chat me up or you want to know how to get this, just WhatsApp me on 08034005928. If you're chatting outside Nigeria, +2348034005928. That's 08034005928. All right. I'm also going to put my number on the screen for you to chat me. Thank you, and see you again in my next video. Bye. If you have any question, please drop it and I will attend to it, or you chat me up on WhatsApp. Thank you.